Do your hands or feet feel numb, tingly, or like they're burning? Most people ignore these signs, but they could mean something serious: peripheral neuropathy. My name is Dr. Ole Olson, founder of Asuta Health Neuropathy Centers, with 4 locations across the Midwest. In this video, I'll reveal the 7 warning signs you can't afford to miss. And if you stick around, I'll share 2 simple exercises that you can do right now to start relieving your symptoms and taking back control of your health. So let's get started. The first warning sign of peripheral neuropathy is watch out for it: numbness or tingling, especially in the hands or feet. This is often the first and most common symptom of peripheral neuropathy. You might feel some pins and needles, like your hands or feet are asleep at all times, and may even start in just the tips of your fingers or toes. Initially, this can come and go, but as the condition progresses, the sensation may become constant. Over time, that numbness can spread further up your arms or legs. Numbness occurs because the sensory nerves are damaged, making it harder for them to transmit signals to your brain. Don't ignore frequent numbness or tingling, especially if it's getting worse. A doctor can perform tests to identify nerve damage early. Secondly, sharp stabbing or burning pain. This type of pain is often described as feeling like electric shocks or a burning sensation. It can range from mild discomfort to excruciating pain that disrupts your daily life. Unlike normal pain, it often occurs without an obvious cause, like an injury. This pain is caused by damaged nerves sending mixed or excessive signals to your brain. Instead of accurately reporting sensations, they interpret normal stimuli, or nothing at all, as pain. If this pain is keeping you up at night or interfering with your activities, talk to your doctor about options for pain management and treatment. Thirdly is muscle weakness or difficulty walking. Have you noticed it's harder to lift objects, climb stairs, or even walk short distances without feeling unsteady? Peripheral neuropathy can weaken the muscles because the motor nerves controlling them are no longer functioning correctly. Over time, this can lead to significant physical limitations. Muscle weakness signals that neuropathy is affecting more than just sensory nerves. The motor nerves are responsible for movement are also at risk. Seek medical attention immediately if you notice sudden or progressive muscle weakness. Physical therapy and other exercises may help slow the progression and improve strength. Number 4, loss of coordination or balance. Do you find yourself stumbling or losing your balance more often? This symptom occurs because the damaged nerves can't effectively relay information about your body's position, making it harder to stay steady. Balance issues often lead to falls, which are a major risk, especially for older adults. Peripheral neuropathy makes it difficult to sense where your feet are in relation to the ground. Use extra caution to prevent falls and injuries. Talk to your doctor or physical therapist about exercises to improve your balance. 5th, sensitivity to touch. Even light touch can hurt. This symptom, known as allodynia, can make everyday activities like wearing socks, touching a blanket, or even a handshake unbearable. The nerves interpret normal sensations as pain, which can be both confusing and frustrating. Oversensitivity to touch is another indication of nerve miscommunication, where the nerves are misinterpreting harmless stimuli as threats. Keep a log of what triggers your pain and share it with your doctor. There are therapies and medications that may help reduce nerve sensitivity. Number 6, feeling like you're wearing gloves or socks when you're not. This sensation, called stocking glove neuropathy, is a common type of peripheral neuropathy damage. It can make you feel like your hands or feet are covered when they're not, leading to clumsiness or difficulty gripping or walking. This happens because the sensory nerves responsible for transmitting touch, pressure, and temperature signals are impaired. If this sensation is affecting your ability to perform daily tasks, it's time to get evaluated by your doctor. Early diagnosis can help manage the progression. And finally, number 7, persistent foot ulcers or slow healing wounds. If you've noticed sores or cuts on your feet that don't heal properly, it could be because neuropathy is affecting your ability to feel pain or detect injuries. This is especially common in people with diabetes. When you can't feel injuries, they're more likely to go unnoticed and untreated, leading to infections, ulcers, or even gangrene in severe cases. Inspect your feet daily for any cuts, blisters, or signs of infection. Seek medical care immediately for slow healing wounds to prevent complications. So what should you do if you have these symptoms? If you have any of these symptoms sound familiar, don't wait. Peripheral neuropathy is progressive, meaning it gets worse over time without treatment. Make an appointment with your primary doctor to discuss your symptoms and get an accurate diagnosis. Early treatment can slow the progression and improve your quality of life. At Asuta Health Neuropathy Centers, we've developed a proven 6-step treatment process called the Asuta method. This method is designed to address nerve damage, improve circulation, and reduce pain while helping you regain strength, coordination, and quality of life. It's a comprehensive approach that focuses on your individual needs to deliver safer and effective results. I'll include a link at the bottom of the video where you can dive deeper into the Asuta method and learn how we use it to effectively treat neuropathy patients, helping them find relief and improve their quality of life. And now for your 2 bonus exercises. As promised, here are 2 simple exercises, one for your feet and one for your hands. These are designed to help improve blood flow, reduce discomfort, and promote healing in the nerves. They're easy to do at home and can be a great starting point for managing your symptoms. The foot exercise we're going to do is toe taps for circulation. This exercise increases blood flow to the feet and helps stimulate the small nerves that control movement and sensation in the toes and soles of your feet. You're going to sit comfortably in a chair with your feet flat on the floor. Lift the front of your foot, where your toes are, off the ground while keeping your heels planted. Tap your toes up and down gently like you're bouncing them off the floor. Repeat this movement 20 to 30 times for each foot. For the hands, we're going to do finger to thumb taps. This exercise stimulates the small nerves in your fingers and hands while improving dexterity and blood flow and circulation. Hold your hand out in front of you with your fingers spread. Touch your thumb to the tip of your index finger, forming a circle shape. Release and move your thumb to the next finger, your middle one, followed by your ring finger, and then finally your pinky finger, tapping each fingertip one by one. Once you've gone through all your fingers, reverse the direction. Repeat this 5 to 10 times on each hand. These exercises are just a starting point. Regular practice can make a noticeable difference over time. But remember, these are not a substitute for professional treatment. If you're experiencing any of the warning signs of peripheral neuropathy, it's important to seek help from a healthcare provider. If you found value in this video, please like and share it. It could help someone else who's struggling with neuropathy. Drop your comments or questions below. I'd love to hear from you. And don't forget to subscribe for more tips and proven strategies to manage and relieve neuropathy. Together, we can work towards a pain-free, healthier future. If you're ready to dive deeper, the next video you should watch is 6 steps to end neuropathy pain for good without drugs or surgery. In that video, I'll walk you through our Asuta method, a proven approach that provides lasting relief and helps you reclaim your life. Click here to watch it now.